Hello and welcome. For my substance presentation, I chose the drug Xanax, so let's get started. Starting off with the background and history, alprazolam, aka Xanax, was one drug created by Dr. Jackson B. Hessler Jr. for the Upjohn Company, which is now part of Pfizer, who applied for the patent in 1969. It was granted in 1976, and alprazolam was the first marketed in 1981. The patent expired in 1993, and Pfizer still holds the trade name Xanax. Several generic variants have since come out onto the market. Xanax belongs to a class of medications called benzodiazepines. These are central nervous system depressants that work the brain's gamma amino aminobutyric acid receptors to reduce calm excitability and reduce anxiety. It quickly became popular because it relieves anxiety quickly, which also leads into addiction and abuse. Social correlates of its use. For demographics, I found that misuse was compared between younger, which is 18 to 49, and older adults. Results: a total of 30.6 million adults, which is 12.6%, reported past year benzo use, which is 25.3 million as prescribed, and 5.3 million misuse. Misuse accounted for the 17.2% of overall use. Adults ages 50 to 64 had the highest prescribed use at 12.9%. Xanax use patterns may vary across age groups, with higher prescription rates among older adults for anxiety and insomnia, and a growing trend of recreational use among younger populations. Studies have shown gender differences, with women often prescribe benzos more frequently than men, although men may engage in more recreational use. Institutional correlates. Healthcare institutions. Prescription rates are influenced by healthcare practices. Education settings may contribute to stress and anxiety, potentially influencing patterns of Xanax use among young students. Health correlates. Mental health conditions. Xanax is prescribed for anxiety and panic disorders, and its use correlates with the prevalence of these conditions. Xanax use may be associated with the use of other substances, particularly in recreational settings. Continuing, economic correlates. Access to healthcare. Socioeconomic factors, including access to healthcare services, can influence the likelihood of obtaining Xanax prescriptions. Employment and job stress. Occupational stress and job-related anxiety may contribute to Xanax use among certain demographics. Cultural correlates. Cultural norms. Cultural norms and attitudes toward medication use, mental health, and seeking help can impact Xanax utilization. Media influence. Cultural representation in media can shape perceptions of Xanax, influence both medical and recreation use. Criminal correlates. The elite market. Xanax is sometimes obtained legally, leading to associations with criminal activity in the context of drug trafficking and non-prescription use. Legal consequences. Non-prescribed use of Xanax can lead to legal consequences. And I found some more information that I found interesting. So medical use might help with the individual's anxiety when prescribed. Recreational use. Some individuals may use Xanax recreationally as a form of self-medication or to cope with stress, social anxiety, or peer pressure. The use of Xanax may also be linked to social isolation, as individuals may use the drug to escape from social situations or cope with feelings of loneliness. Dependency. Long-term and excessive use of Xanax can lead to dependence and addiction, which may result in social consequences such as strained relationships, difficulty maintaining employment, and overall deterioration in social functioning. Media use. The portrayal of Xanax use in popular culture and media can influence social perceptions. Media can both sensationalize and stigmatize the use of Xanax, shaping public opinion and contributing for societal norms, which we'll see more into this later on. Now moving on to the historical and current trends in consumption. Historically, Xanax gained FDA approval in the 1980s and saw increased prescription rates for anxiety and panic disorders. Concern about dependence led to guidance promotion. About dependence led to guidelines promoting cautions prescribing. Currently, Xanax is still prescribed, but there is a balance between providing effective treatment and minimizing risks. Mental health awareness has increased as well as open discussions, but there are concerns about overprescribing and misuse. Misuse and consumption can include taking more than the recommended dose in a day, mostly common administered orally. I think this is actually one of the most important factors when discussing drug use because, especially for the younger generations, I feel like media has such a heavy influence, especially like high school to college age. So, let's get into how the drug is portrayed in the media. The media, particularly in the music industry, has portrayed Xanax in a controversial manner. Rap and hip hop artists have referenced Xanax in their lyrics, exploring themes related to mental health struggles and recreational use. So, again, when people look up to these artists that even use these drugs in their names, like for example, Lil Xan, I mean, of course, their name is one thing, but when they're rapping about mental health, that's one thing. Like, mental health matters, of course. But when you're rapping about how you use Xanax on the daily, and some people just goes in one ear out the other, but others really take advantage of that music and, start a lifestyle with that. And they don't understand the consequences they have on the younger generations. Media coverage has also contributed to a broader societal discussions on mental health awareness, the impact of fame on artists, and attitudes toward prescription medication like Xanax. Celebrities and/or artists also have used Xanax, which creates younger audiences to be easier influenced as well as even knowing the risks and potentials of overdosing. I know so many artists that overdosed at a young age too, and people still continue to listen to them and still use drugs. Legislation and legalization and harm reduction efforts. The DEA has classified Xanax as a Schedule 6 substance under the Controlled Substance Act. Its prescription and distribution are tightly regulated by the DEA. Ways to reduce harm can include prescriber education. Healthcare providers are educated about the potential for dependence and misuse of Xanax. Guidelines and recommendations are developed to promote responsible prescribing practices, emphasizing short-term use when possible. Patient education. Patients prescribed Xanax are typically provided with information about its proper use, potential side effects, and the risks of long-term use. This education aims to empower patients to take their medication responsibly. Moving on to treatment and prevention. Support and treatment programs are available for individuals dealing with Xanax dependence or addiction, including rehab, counseling, and mental health services. I also provided the addiction hotline. The number is 1-800-662-435. To the right on the top, I have symptoms of withdrawal. It includes seizures, anxiety, depression, panic attacks, headaches, insomnia, sweating, and delirium. And the image on the bottom is Xanax overdose symptoms, which include clammy skin, shallow breathing, dilated pupils, and changes in heartbeat. You do not have to be a medical professional to realize these signs, but just always keep an eye on those who may be struggling with their mental health, or if you know someone that's taking Xanax, even for recreational use or medical use. It's always good to be aware of their signs. And remind them that they are not alone and help is necessary before it's too late. And last but not least, I provided the sources, and that is it. Thank you.